Hello, and thank you for joining me. My name is Shil Punatar, and I'm a second year internal medicine resident at Franciscan Health in Olympia Fields. And I'm joined on this project by Ali Carrillo and Carissa Wilkins, who are also co residents, as well as Dr. Kyle Kleiss, who's our attending provider. Our project started as a small quality improvement project, which we've titled What Are Your Wishes? Advanced Care Planning Education and Its Role in Patient Outcomes and Reimbursements. And the basic premise behind our entire project is a situation that many, if not all of us, have actually encountered. A patient comes to the hospital, is quite sick, they're admitted to the floors, and whether something goes wrong or the comorbidities take their toll and a code blue is called. Goals of care discussions aren't completed, and there's really no clear established code status on the conversation or for that patient. And so, what we wanted to do is try to establish these conversations at the time of presentation or sometime during the hospital course in order not only to prevent those outcomes of unwanted medical treatment and unwanted codes, but also to emphasize the idea that these conversations are something that are paid for and reimbursed by Centers for Medicare and Medicaid Services. The basic premise behind this comes down to two things. One is that coding wise, there are actually two phrases and two CPT codes that are reimbursed for all providers. One is code 99497, and the subsequent one, which is listed here, is 99498. And in both of these, there's actually reimbursements available for the first 16 to 30 minutes of a conversation to establish goals of care with a patient or their power of attorney or healthcare decision maker, as well as these next 30 minutes thereafter for every conversation that's had. And in this time, you're actually able to fill out an Illinois Pulse form, which is also briefly mentioned below. For our project, what we did is we took all the inpatient hospitalists and excluded certain providers, healthcare providers such as resident physicians and mid-level providers, as well as specialists. And in this case, we took the inpatient hospitalists and had a 1 hour lunch and learn session created for them to learn about advanced care conversations, help build their comfort, and also to discuss the financial benefit. To aid in these conversations and also for their documentation, we developed two smart phrases, which are both mentioned below, whether it's with the patient themselves or a decision maker, in order to ease the necessary documentation afterwards. And what we did is we looked at the number of advanced care planning conversations under Epic, which has its own tab, before our Lunch and Learn and Smart Phrase implementation, and also thereafter. The reason we've had actually both of these smart phrases listed, we know it takes up quite a bit of space in the middle of our presentation. However, we feel strongly about our quality improvement project and also about goals of care in general. So we've included both of our smart phrases in the middle of the poster so that if anybody watching would like to inquire further or also utilize these in their practice, they're more than welcome to do so. And in general, what we saw for our results, if you look at the bottom and also in the top right corner at the graph, is that over time, before and after the conversation, we saw upwards of an 11-fold increase in goals of care conversations and their coding in the chart. So what that entails is that for every 1 in 100 patients that used to have a documented advanced care planning conversation, we're now seeing that increase to over 1 in 10 patients, a substantial increase. So in terms of our discussion on future directions, we think this clearly shows that these are useful conversations to have amongst providers and patients, and we're happy to provide the education and stress the necessity of these conversations, as well as their role in reimbursement and patient outcomes. And for the future, we'd essentially like to enhance our project. We'd like to look at physicians and providers' level of comfort when they're having these conversations, also to increase our population at hand, so not just inpatient hospitalists, but also residents and mid-level providers. And third, we'd also like to look at some of the financial benefits and reimbursements and actually quantify the amounts of revenue that are being provided after having these conversations, and also time and resources saved and not calling code blues where wishes with the patient are not being honored. In terms of our acknowledgments, we'd like to thank Franciscan Health, of course, as well as our palliative and hospitalist team for allowing us to participate in this project and conversation, as well as ACP for sponsoring and hosting this virtual conference. If you have any further questions or would like to implement this at your facility and would like a hand or have further questions and would like to learn more about our project, please feel free to reach out to me, Shil Punatar, and my email is listed below. Thank you very much.